Good afternoon, Joyful Hermit. I want to share what I consider just a major gift from God, if not a miracle. And that is my pain doctor was so kind, so compassionate today. I had dreaded going in, concerned that I would be told, only one message a week or whatever else. But I was in to get my pump refilled. I didn't dare bring up medications because if you go in for appointment for a certain thing, you're supposed to stick with that thing and then have a separate appointment for the other things. But I had decided not to, that I was trying to make it on another med I have here that is not good for the kidneys, but not terrible. And it doesn't work well. It's sort of lost its strength or something for my pain. So I was been sick with a headache today, and was had to really focus driving, and which is okay. We need to focus driving, but got there, and he was very kind, compassionate, and even brought up pain meds. But he persisted about that he couldn't find anything conclusive, and that lowering the dose of using the morphine and just lowering the dose. And I repeat, I was already on a low dose, and he had cut that in half, but I never took it. I dropped the morphine as soon as I did plenty of research that it is not good for already damaged kidneys. So, and it was otherwise was doing fine with me, but except for what it does to kidneys, and it does not metabolize rapidly or hardly at all. Therefore, it stays in the kidneys, and it causes the kidneys then not to have as much blood flow to cleanse out, so toxins build up. And for all I know, it could have been the switch to morphine in July that maybe caused this kidney thing. Could be that. It could be a reaction to the dye, or what's the other thing? Oh, or my long time use of meloxicam, which is an anti-inflammatory that's a very strong NSAID that they always put back patients or people with pain on immediately. That's what they put you on. And I had even read years ago that it can cause kidney and liver problems, but you have to go on it. As a pain patient, if you refuse meds like that don't have a bad name like an opioid does now and has had, then you're considered you're not trying. You don't care. You're not trying to get better, not trying to or manage your pain. So you accept taking a medicine that is known to cause problems later. And this doctor of osteopath who's in the kidney clinic who called me the other day said they see this all the time with people who've been on meloxicam. The base name of it's called Mobic. The trade name is meloxicam. So, but then when I read this in some abstracts, if you're going to really get a lot of research going to get accuracy, you've got to find medical abstracts on these topics. So I found a couple more, and it explained that you cut the dose in half for morphine on someone who's on it if their kidneys have gone bad, and they're on dialysis, so that the dialysis will flush the toxins of the morphine out of your kidneys. And the point is cutting the dose in half is to wean the person off the morphine totally, and then put them on hydromorphone, or the trade name's Dilaudid, which is the best for kidneys. If you have kidney troubles and you are a miserable, poor soul who has to be on opioids that no other medicines will help you, if you have something like arachnoiditis or other forms of terrible, intractable pain that other medications will not even take the edge off, or have side effects that are terrible for your organs, which some of these medicines can. I was put on a medicine years ago. I can't think of the name of it now, and it doesn't matter because it was taken off the market. I stopped it on my own because I knew it was bad. It could do in your liver. And sure enough, about a year after I went off of it on my own, back in about 1992, it was off the market for too many deaths and dangers and ruined livers. So sometimes you just have to take the least of what's going to be bad. And so the other two meds is a transdermal fentanyl, low dose, or a medication called buprenorphine. And those are both opioids, but those two do not have a bad effect on the kidneys. The fentanyl is less problematic because the studies I found even got into other side effects of these meds, like constipation or dryness or different things like that medicines can have, be they opioids or any kind of medicines. All of them have some sorts of side effects. So if we should be knowledgeable about these things. And thanks be to the Holy Spirit who helps us with knowledge. And God who created our brains. So, and the education that we have, so that we can read and we can study and use the internet for research. But so I'd found this, that they cut the morphine in half, lower the dose for the people who are on dialysis, as a means of then weaning them off of it totally, and then put them on, if they can get it, the Dilaudid. That's the first of choice. But he hadn't done, I don't think, that type of research. My pain doctor hadn't. But he was very kind, very compassionate. He could tell I'm sick with pain and trouble thinking and being fluent speaking and all. But he then went on to do my pump procedure, fill my pump. And that was difficult. He was having a little more trouble this time finding through the skin the opening, the little tiny place that he can get the needle in. And it's painful, and there I am. I've got to try to puff my stomach out, and I've lost so much weight, there's not much to puff. And to make it easier for him to get to that spot. But I asked then later, I said that because he wanted to know how I was doing. And he did ask me what I was taking. And I will always be honest. I thought if he wasn't going to ask me, I wasn't going to say that I had dropped the morphine like the hot potato about 3 weeks ago, not quite 3 weeks ago, when I started reading how it's the worst for bad kidneys. And I consider even at a half dose, well, what good was that doing me in so much pain? Because then the rest of my body, you do a lot of damage to your body if you let it go in pain, if you have constant pain. It raises blood pressure, it creates a temperature, it can cause stress on your organs. So it's sort of a no-win situation in a way, the thing you have to try to do. So I told him, I said, I have been trying to focus and learn dispassion so that pain or no pain, or pain or less pain, I've not had no pain for 39 and a half years, but pain or lesser pain, I said, I offer it all for the love of God and Himself. And something else came up. I said, I'm trying to train my mind to focus all the more on love of God in Himself and away from my body, because he asked me different questions, and I said, I don't know. I keep my mind as far away from my body as I can, so that I focus on the love of God and himself, and I explain dispassion to him. He's interested in religion very much. He's a Christian, strong Christian. And so I repeated probably three or four times different aspects of loving God in himself as a means of rising beyond my body and the headache and the pain in order to be there for my appointment, in order to exist in here. And he did say, well, it's obvious that this isn't going to kill you, not soon anyway, that this that this is getting more under control. I told him how I'd gone up 16 points in the GFR. So as he was doing the pump, I asked him again. I said, would you possibly consider calling in one of these two medications? I said, since the Lauded is nowhere to be found in the entire region. And he just quietly said, yes, I can do that. And I said, I am so grateful, because I said, from everything I read, I said I did get a block against taking the morphine anymore. I did not tell him that that could have been what caused this reaction, this allergic reaction I had. But I read that also. I didn't want to get into it, because he's convinced it's from the dye, the MRI and CT scan dyes, contrast dyes. I've had 3, and 2 or 3 that had dyes in them in the last 6 months. And then the osteopath doctor is convinced it's from my meloxicam use for 36 or more years, which, of course, I hadn't been taking that really since before my knee replacement in June. And then I think out of a bottle of 90 meloxicam, I maybe had taken 25 or 35, something like that. So I hadn't been really consistently taking it, which caused her to say, well, is there anything else at all that you have stopped taking or that you were taking that was new, and then that you stopped when my kidneys got so bad, and I knew, they told me, get off this, get off that. And I'd forgotten that I had stopped the morphine, but that was started in July with me to help, because the knee pain, my regular medications, hydrocodone, was no longer effective. I'd been on it a long enough time. You can develop a tolerance. So, and I'd been on it for several years. Low dose. And I conscientiously keep these things at low dose. But as arachnoiditis progresses, and I am human, but here's another advantage for us. And it's not that we're wanting to love God in himself for the advantages to us, but there are blessings. And one is more dispassion of ourselves, less selfishness, less awareness of how we feel, how we are thinking, or what's happening to us, because our minds are so focused on God in himself and his pure love. And we become inflamed with love for God and for God's love, for that purity of love. So, but we then lose track of ourselves more. Therefore, we won't hurt as much. We'll be able to take more hardships without flinching, without letting things get to us. We'll be able to have better control over our emotions. and not let our thoughts get away from us, and our panic or our fear of, I don't even want to go to the doctor's appointment because he might yell at me or something. That was me. See, I'm not there. I am, the more I'm learning and being reminded of things, and I had read this book, but I hadn't finished it. It was when I was on the island. It's excellent. This book by John Climacus, 3rd or 4th century, lived near the Syrian desert and became a great and evolved monk and beautiful soul in union with God. And he wrote The Ladder of Divine Ascent. There are all these different steps with his writings and his suggestions and his explanations and tips. So in the next video, I'm going to read and go over dispassion. In other words, dying to self, because he explains the differences. He gives examples of how someone is if they have the passion, if we have our passions, ourself more in mind and foremost, compared to the person who has dispassion or has died to himself for the love of God. For the love of God and himself is what we do all for. It's what we breathe, live, think, praise God for. It's for the love of God and himself and his pure love with which he showers us and spoils us like he did me today. What a favor, because God knows that I am not at that spiritual level of dispassion where I do not notice my high-level arachnoiditis pain. God has brought me a long way with pain and pain management. But the headache today has been sickening and very distracting from what I could otherwise be doing. I became testy and impatient with the pups when they kept wanting to go out, and Mercy kept, she's very picky about where she pee-pees. Has to find just the right spot, bless her little heart. And I got frustrated and said, no, we've got to go in. I've got to get ready, go to the doctor, and pulled on her. She was on, they were on leashes, and I said, no, don't pull. And she's sensitive and she's so well-intentioned little puppy. And she just looked up at me like, but Mom, I want more time. I want more time. I said, we can't have any more time. And they could tell. They could tell my pain level this morning. So, anyway, so Dr. Marsh, they're calling in. Just so happens there are 29 2 milligram of the hydromorphone. It had been all gone. It had been a total shortage of it. Wasn't to be found, but some came in, and I will have a chance to try those. And I am going to keep it at a very low level. Just as I told the pain doctor that I want to offer for the glory of God, for the love of God in himself, to detach and to see if I can work more on my attitude when I am in high pain. If I can let love of God enter into a point of my awareness that I will be able to shove aside my grumpiness, my testiness that I get when the pain is getting too bad. But I will have to be careful not to let it get out of control. For a pain patient, then that can get very bad. And then it takes a lot more to get it back under control. And you involve other people. You have to bother them, go to ER or whatever. And so I have to be prudent. And I looked at the pain doctor and I said, it's very sad and unfortunate that anyone has to have so much pain that they need opioid medication as their only recourse. That the over-the-counters and that other medications, because people have tried to invent many other medications to, they would become rich quick if they could find something that really worked as well as opioid does with pain. But they haven't found yet. I'd even read about another pain doctor, and he has a new gimmick that he uses. It's some kind of scrambler, it's called, a nerve distracting scrambler. Well, I had been on something very similar to that years ago. I've tried everything, but and ended up, of course, when it was found I had arachnoiditis, then Mayo Clinic is very clear on that. Really, the only medication to ease the pain at all are opioids. So that's where you are with it then. And it's humbling. And I told the pain doctor, it's very sad because I said, the entire society, the government, society, all the people in the society, most all medical people, especially the young ones, because they have been indoctrinated that opioids are evil in essence and have no use and will destroy the mind, will destroy this. The nurse practitioner of the kidney group was convinced that they harm your organs. No, they don't. The pain doctor's ignorance. That's ignorance. Of course they don't. But if you have genuine and high level pain, if you don't have high level pain and the opioid is just in your system going to work on whatever else, messing up your mind, depressing your breathing in your lungs. If you have pain, that medicine goes to the point of the pain and works on it. You're never high if you have pain and take opioids. I've never been high. You're not addicted. Now, if you have an addictive personality and you've had trouble with addiction in your life, then you can be, and they have to be careful with you on that. But if you don't, and most people are not addictive personalities or have not had serious addiction issues and been in rehab and things, then you don't have any addiction because it does not take the pain away. The main aspect is it takes the edge off the pain, makes it so that you can function, think, so that your body doesn't go into some kind of it actually can go into a kind of a shutdown where you are in bed and you lose your capability to control your emotions. And this is what my 3 darling children went through, when they were very young. Their mother in bed, crying and screaming, begging God for help to cope with the level of pain. A neighbor would come, load me in a car, drive me the few blocks to my GP back then when I was after the accident and the surgery, and he would give me a very strong Demerol-Vistal combination injection, which later some other doctor in India said, oh, that would kill a cow that much. No, it didn't. That he experimented with different amounts, and it took a massive amount once that pain was out of control. And then I would be brought home help me get in bed before I totally conked out. I would be conked out for a good 24 to 36 hours. The neighbors would be alerted, other neighbors with this one neighbor. They'd either come get the kids and take them up to their homes to feed, or even if I was in really bad shape, spend the night. Or they would bring food for the children and they would check on them. And the oldest, who's very sensitive and has trouble handling my ailments, and I understand why. Now I really do. She had the responsibility and felt it. And the next one down did a lot. They'd come, the second one would come and work on my neck, my feet, my whole body would be in agony. And it wasn't that I didn't want to cry and scream. The pain, you get out of control. It gets to be more than the human person can cope with. And yes, God was there with me, but I did not have the spiritual knowledge or experience that I have now. But thanks be to God, finally, when my children were out of the home, all graduated, it was 2008, 2009, the crying couldn't stop. I couldn't function. And it was a doctor's nurse, back in the Midwest, who I thought I was having a breakdown, some kind of terrible breakdown, and it had been going on for quite a while. Now, I'd go try to do shopping, I'd just be sobbing, and people would be concerned, and I'd have to say, it's pain, well, can't you do so? No, I couldn't. I had no medication. And I was taking way too much Aleve and other things that are bad for your kidneys and liver, if you have to take it to that extent. So this nurse said, no, you're in way too much pain. A person can't have that kind of pain and keep going. And thank God for her. And she told the doctor, and he prescribed low dose hydrocodone, and very low dose. But they also explained that the nurse explained, you have to stay on it. You don't just take it when the pain siege is coming on. You have to have a steady level of it in your body to keep on an even keel. And finally, I still had the terrible spinal headache pain sieges that were horrific. But I wasn't screaming in agony. Yes, I would call out to God for mercy, but I was alone in my home. I didn't have any pets then, and I had an angel come once. I had Jesus come a few times. I was being consoled. The Virgin Mary would come. I started having spiritual help. But, and I did before also, but the extreme of the pain, and of course I was younger. When you're younger, your nerve endings are more alive. They are fresher. As we get older, it's more dulled. However, high amount of pain on an old person is far more damaging to the body. So anyway, I mentioned that to my pain doctor about how it's really unfortunate, and it adds to the suffering when you have people making comments or making their assumptions, especially medical people, like another office where I don't have a GP. There's such a shortage of doctors here. So I said, well, to the nurse practitioner, couldn't you please take me on? Because she has patients like a doctor would. But she said no. She didn't like the medications I have to take. even though she doesn't have anything to do with them. But she had that kind of a bias against genuine, convinced that they are terrible and that they do all kinds of harm. And then I had the little lecture from the nurse practitioner about how oh yes, they do damage your kidneys. No, they don't. But certain ones now, though, if you already have damaged kidneys, there's foods you shouldn't eat. There's over-the-counter herbals and medicines you shouldn't have. And there's certain pain medications you should not have. And then there's these three, and praise be to God, I'm going to get the low dose of the one that is the best to have. I consider it a miracle. I am so grateful because I am trying to eat more and my nausea has stopped. That was all connected with the kidneys, we're pretty sure. And the kidneys were slowly shutting down. And then all of a sudden it, got extreme. That's what happens when you have acute kidney injury. You go into kidney failure after it sneaks up on you silently. That's what the nurse practitioner explained. So just sharing with you a little bit about pain medications. And please, I also think about people who are depressed or have mental illness. They get a lot of bias against them. Can't they just snap out? Cheer up, No, they can't. Their brain chemistry is messed up. Their dopamine, their endorphins, and other aspects, their hormones can be so messed up. And it can become ingrained too. And then they develop, out of depression comes anxiety disorder, where they worry for other people's worries, because they can't help it. Maybe way, way back when they were little, if they'd had, if the parents had understood and gotten them in with some top crack psychologist to help, maybe, but it can still be a brain chemistry issue that needs to be addressed. And back in the day, didn't have that. And think of all the people who are poor, the poor children of poor parents, or children of parents who aren't as educated and who aren't aware of these things, or to get their child to maybe they don't have insurance, or their insurance wouldn't cover it, maybe. Or the stigma of they don't understand. Well, cheer up, don't be sour grapes, don't be a worrywart to a child. No, they need help. So just awareness, and I wanted to talk to you about opioids. And because I have known people who have refused them when they were injured even. And my aunt, my aunt, she was a great one. She had massive stroke, nearly killed her, intensive care 3 weeks, and had to relearn everything from walking to eating to speaking. Could somewhat, could never read again. It ruined her eyesight, did major damage to her body, and she had been active and thriving up until that point. She had a very bad sciatica pain. Her doctor, her GP, prescribed her 3 days worth of a low dose of hydrocodone. Vicodin was the trade name of that. She was scared because of all this indoctrination. Scared she would become addicted. And also sort of a pride thing, she admitted. She didn't want anyone to think that she would take anything like that because it was so horrible. It's been made to be evil because of the drug addicts, because of people who shouldn't take it but do. But all the government cutbacks and control over manufacture. So I don't know what I'll do when the 29 are gone, 29 little 2 milligrams. But uh, the addicts, and it's not just street addicts, there's all kinds of people become addicted to these opioids who don't have pain. And that's why they become addicted, because they become high and they become addicted to the high. Read Mayo Clinic's discussion of opioids and also of arachnoiditis if you want, but of opioids, and how people can become addicted and how other people aren't, who have sincere pain, legitimate and high level pain. Minor pain, take your over-the-counters and gut it out. Major pain, it gets to the point with some of it you cannot. It gets that severe. After surgeries, I know of a cardiologist in the Midwest who has been under-medicating his post-open heart surgery patients. His PA, his mom is a good friend of mine, and the PA has been very upset of how those people coming out of open heart surgery are suffering horribly because they aren't given enough pain medication post-op. To me, that's sad because, and most people with open heart surgeries are older people too. The bodies can't take that kind of pain without some ramifications happening. And to have all that upset and tension and crying when your body needs to be healing, really should have optimum conditions, and then taper off. Taper off. But my aunt refused to take even one that would have reduced her pain. The pain got so bad that it shot up her blood pressure and she had massive stroke. She would have died, but she was waiting for her daughter to come, and before she had this stroke, she had cracked the door open. And her daughter was coming to take her to another appointment, different appointment, and found her mother there, nearly dead. So, anyway, that's my public service announcement. And do not take it when you don't need it. That's common sense. But please do not hold a bias or misinformation or a fear of it to the point that when you do have an accident sometime or a surgery, you then cause your body and your organs more stress and your blood vessels more stress by refusing medication. Unless, of course, you have come into union with God and have that level of dispassion that you can take superhuman levels of suffering without it bothering you. I'm not there. And I don't know. I mean, with arachnoiditis being a progressive ailment, I've had to humble myself and accept that this is part of my life, and also the bias that I get. But it is sort of a suffering on top of a suffering. You can understand that, of how people view and judge in negative light and put down. My handyman gave quite a lecture. He was irate. And he would never take anything. And, well, we'll see. I thought I was pretty tough, and I tried my best to smile through and not show anything in front of my children, but sometimes pain Sometimes it seems like God teaches us through pain. And it was humbling to realize that I couldn't handle that level of pain. So, end of my yap on a very temporal topic. But please be charitable to those who are stuck. Wow, he put it to the pain doctor. It's sad to be stuck with so much pain that you have to take something that the entire world is against and misunderstands and assumes. Like we had the one viewer that time who got angry with me and for something I had said, and put the little knife in and gave it a little twist, saying, well, you're like this because you probably can't think clearly because you're on so much pain medicine. So you get that kind of stuff a lot from people who don't know or who should know but want to use that against you. Or, oh, you didn't drive, did you? You didn't drive here. Well, I shouldn't drive if I'm in over-the-top pain. So yes, I drove here, very much in control. And unless you're in the person's position, I don't think it's possible to know because of so much of the other information put out there of what it does to people who don't have pain, who are addicts. Yes, it does mess them up mentally and physically and emotionally and psychologically. So, but big difference. And it's okay if you disagree with even my video on this, but at least have compassion and try not to judge. And even those who are addicted, I feel very sorry for them. And it's too bad they ever took anything to begin with when they didn't need it. I think it often starts out with even like marijuana or something, and then they graduate into other things. Or kids goofing around and take a pain pill that maybe their mom or dad had for a surgery they had. And that's why it is important for parents to get rid of their medicines when they're done with them, or keep them under lock and key if they are still needing to take something for a surgery or something like that. Or God forbid if they have arachnoiditis. God bless his real presence in us. And anyway, I just wanted to share the miracle, the blessing of my pain doctor agreeing to call in the low dose of the medicine that is the least harmful to the damaged kidneys. I'm so grateful and hoping that I'll be able to do better for the love of God and himself.